Let's talk about the biggest health crisis in recent times, the COVID-19 pandemic. This December will mark 3 years of the crisis. It started off as an obscure outbreak in China, but within months, it locked down the entire world. I know most of you have suffered in these last years, maybe lost a loved one or lost your job due to the lockdown. But all that could soon be coming to an end because on Wednesday, the World Health Organization's chief had this to say.
We can see the finish line. We are in a winning position, but now is the worst time to stop running. Now is the time to run harder and make sure we cross the line and reap the rewards of all our hard work.
Sounds encouraging, doesn't it? After almost 3 years, the pandemic could be coming to an end finally. Yes, it calls for a celebration, but it also calls for caution. Like Dr. Tedros said, this is the worst time to stop running. This is the time to deal the killer blow, to end the pandemic once and for all. The last thing we need is complacency, and these numbers will tell you why. In 2022 alone, more than 1 million people died from COVID-19. Around 321 million contracted the virus. So the pandemic isn't over per se. The difference is we are simply better prepared to handle it. We have vaccines, boosters, medicines, everything we need in an arsenal to combat the virus. Having said that, two challenges remain. The first is vaccine equity. Yes, 2 years later, we are still talking about the same issue. Most Western countries have announced booster doses and double boosters even. But in Africa, vaccination continues to be slow. By July 2022, only 21% of the population had been double-dosed. Imagine that. Only 1 in 5 Africans had been vaccinated, and that's the #1 priority as of now. To make sure that every part of the world has access to vaccines, it will be key to reopening national economies. The second challenge, of course, is long COVID. We've been talking about it on the show. There is very little we understand about the long-term impact of this virus. Almost every day, there is a new study out. The latest one talks about gender disparity. 1 in 3 females are likely to suffer from long COVID, it says. For males, it's 1 in 5, which means women are twice as vulnerable as men. Another study links long COVID to mental health. Assume you were stressed or depressed before you contracted the virus. Chances are you will have long COVID. This study was carried out by Harvard. It found that psychological distress increased the risk of long COVID by 32 to 46%. My point is this: we are still learning about this problem, about this virus, and chances are it will be quite a long process. There will be multiple studies, theories, and trials before we can conclusively understand long COVID. And whatever you do, don't make a joke about it. Like this actor from Pakistan. She was on a philanthropic tour of flood-hit areas. While crossing a bridge, she had a sudden spurt of brilliance. Why not feed the fish below? The actor took out packets of bread and emptied them into the river. So far, so good, right? But what she did next has enraged netizens. She threw the plastic wrapper into the same river. So much for saving aquatic life. When social media users called her out, this actor came out with the most bizarre explanation possible. Listen to this. I have had COVID twice and its effects are still there. I forget things and don't remember what I did 4 hours ago. As far as excuses go, not a good one. This actor is blaming long COVID for her negligence. She's calling it brain fog. Now, just to be clear, brain fog is a symptom of long COVID. Doctors say that 22 to 32% of recovered patients display this symptom. But blaming it for your mistakes is certainly not okay. Chances are we will hear more such stories in the future. Bizarre incidents blamed on long COVID, which is why we need more medical studies. We need to understand how to identify long COVID and how to treat it. And this requires government help. Remember how every world leader was taking credit for the vaccines? You remember that? It was almost like a race. Well, we need the same eagerness to solve long COVID as well. WION World is now available in your country. Download the app now and get all the news updates on the move.